Cubicle 3, PFO. Pissed fell over. Cubicle 4, PGT, pissed got thumped. Cubicle 5, PDE, pissed denies everything.
So, where you from?
Leicester.
No. Where you from?
Sweden.
India, I reckon. Not all Pakis come from India, though.
Hello, my name's Raj. You've got a headache.
Yes, Doctor. All day.
Any sickness or drowsiness?
No.
And how bad is your headache?
Just pain down the side of my head. Nagging.
Nagging?
Raj, in 12, tib and fib of the compound variety.
I honestly don't think this is anything to worry about. Take paracetamol and see your GP if it's no better in the morning. Silly cow. And what appears to be the problem?
Claire.
Oh, I'm sorry.
Listen, I'm RMO today. It was only Dr. Turner's blasted outpatient. She wouldn't hold the bleed for a couple of hours, would you?
Yeah, sure.
Ah, thanks. Ta.
Oh, Raji! I saw this out shopping and I knew it'd be just right for you. Let's put it on your tie.
So, when was it that you and she... During my house job. Bloody hell, a year ago.
When was the last time you had a bit of how's your father? A year ago?
Now she gains a full-scale deflection on Raj's barometer. Babe alert, casualty. Repeat, babe alert, casualty. Hello? Sprained wrist. Let me have a look at that for you. So, what's a joint like this doing in a nice girl like you?
Claire, 17-year-old lad fell off a bridge into a lake. Clear. His mates took 20 minutes to fish him out. There's been no output since.
The pillock.
Will someone find a low-reading thermometer then?
Clear.
Rectal temperature's only 25 degrees.
Put the defib away. OK, Phil, I want blood gases, full blood count, UNEs, glucose amylase, LFTs, clotting, a chest X-ray and a 12-lead ECG. James, where's the nearest place with access to ECC?
Nowhere within 30 miles.
OK, well, he stays with us. Wrap him up. I'll pass the central line and run in some warm fluids. James, will
Warm,
you...
humidified oxygen. May as well ventilate him after.
OK.
It's a different doctor every 6 months I come here. Dr. Turner's given up on me. He thinks I'm a medical mystery. The first time I had this problem was in London in 1977.
The thing is, Doctor, I've noticed this ache.
I'm very pleased with your progress, Miss Kleiner. Thank you. Discharge back to GP staff.
Nurse said you wanted to see me, Dr. Turner.
Yes, Andrew. She tells me you're taking too long with your consultations. 10 minutes is all we have.
Well, I'm finding it difficult to cover all the patient's problems in that time.
The managers tell us we can see people in 10 minutes, so we see them in 10 minutes. Acquainting oneself with the patient's background and the result of recent investigations, 1 minute. Calling the patient in, perhaps as long as a minute, if they're old and disabled and need assistance. The patient being taken through to the examination room and having to undress, as long as 2 minutes, if they're infirm and have many layers of clothing. Examining the patient, 2 minutes. The patient getting dressed again, 2 minutes. Phoning the laboratory for a very important result which hasn't been filed yet, 1 minute. Thank you, staff. Completion of audit form so the management can see how we're doing. 30 seconds. Booking new appointment and ushering out. 30 seconds. How many minutes is that, Andrew?
10.
The system doesn't allow for the most important thing, talking to people. I don't make the rules, Andrew.
Thank you, Dr. Turner.
Oi! Time for some more adrenaline. Right, that's a quarter of a milligram there.
Aren't his lungs going to be full of water if he spent 20 minutes drowning?
The X-ray showed no evidence of pulmonary edema.
A lot of victims of near drowning have no water in their lungs due to laryngeal spasm. This lucky lad is a dry drowner.
Forgive the delay. My outpatients is horrendously overbooked again.
Thank you for coming, Dr. Turner. We've got a 17-year-old boy here involved in a dry drowning. Core temperature on arrival of 25. He's been in ventricular fibrillation now for 2 hours. We're providing basic life support and occasional low-dose adrenaline. I don't anticipate successful cardioversion until the core temperature is at least 30 degrees.
Quite right. I suggest we accelerate rewarming with peritoneal lavage. I try to feed the line into one of the paracolic gutters.
Yes.
The principle is that we bathe the abdominal cavity in the warm saline so that the heat is transferred to the central circulation. Thank you, sister. I advise that you exchange the fluid at intervals of 30 minutes to 1 hour.
Yes, Dr. Turner.
You do the next one, okay? What do you say his last temperature was, staff?
27, Dr. Turner.
Good. Keep going. I'll be an outpatient if I'm needed.
I think it's changed, you know.
Who?
Mick.
Why? What's changed about him?
Well, I think he thinks it's the right time to settle down. We set a date in the spring. And we can practice you catching that bouquet if you like.
Oh, hardly.
It's about time you had a fella.
Yeah, but there's still not much better contraceptive than having a 12-year-old son at home.
As you know, in the Accident and Emergency Department, we have actively been seeking a locum consultant until a permanent appointment can be made. Now, while efforts continue in this regard, the present situation will obtain in that the consultant surgeon on take will cover accident and emergency.
General surgeons shoulder enough responsibility without the added burden of A&E.
The second item pertains to the changes to the surgical specialties on-call rota. Now, unfortunately, there aren't sufficient funds to finance an arrangement for ENT. It has therefore been proposed that one of the on-call SHOs in general medicine cross-covers.
Physicians doing surgery. It's been a long time since I heard out so daft.
The vacancy in ENT cover coincides with the on-call days of your firm, Dr. Yates, and Dr. Turner's firm.
Barry's SHO is Claire Maitland, second-year SHO with full MRCP. If asked to cover ENT, I have no doubt she could obtain a post elsewhere.
Your SHO, Dr. Turner?
Andrew Collin, new to the rotation, lucky to gain a place, considering his mediocre academic background.
I see.
Gentlemen, this proposition is lunacy. To have our junior doctors under training in one discipline, then to give them clinical duties in another, unrelated discipline, with no previous experience, with an adequate senior staff cover, is a monstrous abdication of our responsibilities.